What if I tell you that there is a real solution to the problem of arthritis that is not always mentioned? This is not about a new miracle drug or an expensive operation. We will look deeper than just pain and diagnosis into what many doctors manage to explain in a short appointment. For years, we were led to believe that arthritis is inevitable, that reaching a certain age means you are doomed to suffer, that it is part of aging. But what if it is not so? What if the real problem is not age, but what we do or do not do when that age arrives? In this video, you won't hear magical solutions. I won't promise instant miracles, but I will tell the truth that is often ignored, downplayed, or poorly explained. We will discuss what truly causes arthritis and how it can be reversed, not just alleviated or slowed down, but actually returned. The fact is that the human body has an amazing ability to heal, but it needs the right conditions, which are not always related to pills. This may surprise or even upset you, but like many before, this video can give you hope. If you live with pain every day, if it's hard for you to get up, walk, or move freely, you deserve to know that there is a possibility to do more. And if you have no symptoms yet, but you've already heard the words wear and tear, cartilage, or inflammation, you should listen to this before it's too late. So I invite you to stay, listen carefully, and most importantly, ask yourself a key question. Am I doing everything possible to improve my situation, or am I just surviving on what is given to me? Before we continue, let's get to know each other a bit. How old are you, and where are you watching from? Write in the comments. It's really important for me to understand who I'm communicating with. Now, let's get started. What is arthritis really, and why is it so common? To learn how to cope with arthritis, one must clearly understand what it is and what it is not. Arthrosis is not just knee pain or age-related ailments. It is a chronic disease affecting the joints. Its medical name is osteoarthritis. Although many perceive it as a natural consequence of aging, it does not mean we should accept it without a fight. Simply put, arthritis develops when the cartilage covering the ends of the bones wears down. The cartilage acts as a soft cushion, allowing the bones to glide over each other. When it is damaged, the bones begin to rub against each other, causing pain, stiffness, and inflammation. Osteoarthritis is often confused with arthritis, but they are not the same. Arthritis is an autoimmune disease where the immune system mistakenly attacks the joints. Arthrosis is a degenerative disease caused not by the immune system, but by progressive wear, excessive strain, or even lack of activity. Interestingly, why do so many people suffer from arthrosis? The first obvious reason is age. Over time, cartilage loses its elasticity and ability to regenerate, but this is not solely related to the number of years lived. There are other important factors: genetic predisposition, excess weight, obesity, old injuries that were poorly treated, and surprisingly, a sedentary lifestyle. Yes, it is indeed hypodynamia. Many believe that by avoiding physical activity, they are preserving their joints, but in reality, the opposite is true. When we don't move, the muscles that support the joints weaken, accelerating cartilage wear. Furthermore, modern lifestyles also play a role. Hours spent sitting, lack of movement, diets full of sugar, and ultra-processed foods lead to chronic inflammation in the body. An inflamed body suffers, primarily affecting the cartilage. To illustrate this, I will tell the story of Anna. She is 73 years old. She has lived alone for almost 10 years and has always been an active woman, although she was not fond of sports. Her daily activities included caring for the garden, cleaning the house, and going to the market. Simple but important things. However, about 5 years ago, she began to feel discomfort in her knees. The pain that initially occurred occasionally soon became constant. The doctor diagnosed arthritis. "Madam, at your age, this is normal. Here is some pain relief, and please rest." Anna complied. She began to walk less, started using a cane, and spent more time sitting. But the pain not only didn't disappear, it intensified. The doctor prescribed stronger painkillers, she received an injection, and then came acceptance. The saddest part is that no one explained to her what is really happening in her body. No one said that excessive rest can worsen arthritis, and that diet, emotional state, and lifestyle have more influence than age. And she is not alone in this. Millions of people live in such a state, believing arthritis is an inevitable fate, although in many cases it is the result of years of ignoring the body's signals and harmful habits. But there is good news. Our body has an amazing ability to heal. You just need to understand what he needs, and that's what we will find out now. When you are diagnosed with arthritis, the first thing you receive is a prescription for paracetamol and ibuprofen, diclofenac, or another analgesic or anti-inflammatory drug. And, of course, in the first few days, it seems to help. The pain subsides, you can move a bit more, and feel that everything is under control. However, there is an important truth that almost no one voices at the beginning. These medications do not cure arthritis. They merely temporarily slow its manifestations. Imagine a tap that is dripping and drops fall every hour. Instead of fixing the pipe, you just cover the faucet with a rag to avoid the sound. This is how ordinary medications work. They muffle the noise but do not solve the underlying problem. Meanwhile, the wear of the joint continues, unnoticed, as the analgesic does its job. It seems that things are getting better, although the body continues to deteriorate. Non-steroidal anti-inflammatory drugs like ibuprofen or naproxen may be helpful in the short term, but long-term use over months or even years can cause serious harm. Damage to the stomach, liver, kidneys, increased blood pressure, and even a threat to the heart. Ask Manuel. Manuel, 76 years old, has worked as a carpenter all his life. He has arthritis in both hands, and the doctor prescribed him ibuprofen every 8 hours to relieve the pain. At first, he felt relief. Manuel resumed his tools and even did minor repairs around the house. However, after 6 months, he began to have digestive issues, heartburn, nausea, loss of appetite. One day, he was struck by severe abdominal pain and found himself in the emergency room with a stomach ulcer caused by anti-inflammatory drugs. Then he realized that this could not continue, and he asked himself the main question: why is he given means that relieve pain but cause harm elsewhere? The answer is harsh but simple. Conventional medicine focuses on alleviating symptoms and rarely seeks the root cause. This does not mean that doctors are bad. Most of them try to do their best based on what they have been taught. However, the system is geared towards quick solutions that can be prescribed rather than spending time on truly educating the patient for real recovery. This concerns not only arthritis. Many chronic diseases are like this. Therefore, many patients resign themselves, believing they have only two options: lifelong treatment or a life of pain. But this is a convenient illusion, an incomplete understanding. Arthritis can improve if treated from the roots, and the root, as we will see further, may lie in hidden inflammation, a deficiency of certain nutrients, hypodynamia, and other factors that are rarely resolved with a single prescription. So if you take pills every day and see no improvements, it's not your fault. It's the result of an approach that treats the body like a machine to be turned off, rather than a living system capable of restoring balance when the right conditions are created. The good news is that it is not too late to change the situation. This text is not to blame you, but to open a new door, to show what many do not explain during the appointment. Although it is impossible to turn back time, one can start moving in a different direction today. The approach that almost no one considers is healing from within. When we think of treating illness, the first thing that comes to mind is medicine. A pill that helps, a cream that alleviates pain, an injection that soothes symptoms. But what if the real solutions lie not outside, but inside? This is the moment when many open their eyes. It is not enough to just take a pill. It is necessary to change the internal environment of the body. This is the main principle of functional and regenerative medicine. This approach to health does not just mask symptoms, but seeks the causes of their occurrence. And the most important thing is how to eliminate the source. Do you know what common factor unites arthritis and almost all chronic diseases? It is inflammation, but not the kind visible to the naked eye, like a swollen ankle or a red knee. It is about chronic, hidden inflammation that accumulates over the years without your knowledge, caused by various factors such as irritating foods in the diet, accumulated stress, lack of sleep, toxins from the environment, and imbalance in gut microbiota. If inflammation lasts for a long time, it begins to damage tissues, including joints. Imagine that the cartilage is like soft cushions. Inflammation is like a small flame that keeps burning. With each passing day, it gradually breaks down this protection, and at some point, the body can no longer keep up with its restoration. Therefore, treating arthritis from within is not just about applying ointment to the knee. It means extinguishing that flame. How to do this? There are several ideas that many are not even aware of. The first is nutrition. There are foods that promote inflammation and those that reduce it. White bread, sugar, sausages, and fried food are like gasoline for fire, while fatty fish, green leafy vegetables, seeds, and extra virgin olive oil are the water that helps it stew. The second is the intestine. Yes, it is. It is called the second brain for a reason. When the intestines are damaged due to stress, medication, or poor nutrition, they become permeable and start allowing toxins into the bloodstream, triggering an immune response throughout the body, including the joints. Do you know that many people with arthritis also have digestive issues, mild allergies, or chronic fatigue? All of this is connected. The body does not function in parts. Everything is interconnected. The third is oxidative stress. This term may sound complex, but it actually refers to cellular wear caused by internal and external toxins. They create molecules called free radicals that damage tissues and accelerate aging, including the destruction of cartilage. Here, the traditional approach proves ineffective. No matter how many painkillers you take, if you feed inflammation, increased intestinal permeability, and oxidative stress every day, you only temporarily mute the symptoms without addressing the cause. It feels like scooping water out of a boat with a bucket without plugging the hole in the bottom. So, when we talk about healing arthritis from within, we mean deep changes. It's not a 3-day diet or a trendy supplement. This is the transformation of your body into an environment where healing prevails over destruction. The most inspiring part is that the body always strives for healing. It needs you to remove obstacles and create the right conditions. It's not easy, but it's significantly more effective than any pill. When you understand this, you are closer than ever to giving your body what it truly needs. Nutrition can be real medicine for arthritis. When they say food can heal, it may seem like an exaggeration or a trendy notion. However, with arthritis, proper nutrition is one of the most powerful tools, as what you eat every day affects not only your muscles or stomach, but also directly impacts your joints. Joints are not isolated from the rest of the body. They are alive, needing nutrients, regenerating, or wearing out depending on what you have on your plate. The truth is that many seemingly harmless foods hinder your recovery. Let's start with the nutrients that truly help. Your body needs 3 key groups of components for joint protection and renewal. The first is fatty acids with natural anti-inflammatory properties. They are found in salmon, sardines, tuna, and mackerel, as well as in chia seeds and walnuts. Regular intake of omega-3 helps reduce inflammatory processes in the body, including the knees, hips, and hands. The second important element is collagen, which is the main protein making up cartilage tissue. With age, its production in the body decreases, but its synthesis can be activated by consuming bone broth, eggs, unsweetened gelatin, fish, and meat with bones. Type 2. Collagen supplements are also beneficial, especially when combined with vitamin C. Thirdly, antioxidants help combat oxidative stress and protect cells from damage. They are abundant in red berries such as cherries, blueberries, blackberries, and strawberries. They are also present in broccoli, spinach, and kale. The brighter the color of the vegetable, the more antioxidants it often contains. However, alongside healthy foods, there are those that gradually destroy joints, with sugar being the most dangerous. Refined sugar promotes inflammation, weakens the immune system, and feeds harmful bacteria in the gut. It's not just about the sugar added to coffee, but also the hidden sugars found in bread, cookies, cereals, packaged juices, and low-calorie products. Another hidden enemy is ultra-processed foods, those packaged products filled with preservatives, colorings, refined flour, and low-quality vegetable oils. Convenient food that harms health, as well as fried products and oils that have been reused. They form toxic compounds that contribute to inflammation, burden the liver, and worsen the overall condition of the body. To better understand this, I will tell the story of Teresa. Teresa is 72 years old. She lives in a small village, and she has always loved fresh bread, coffee with sugar, and homemade pastries. When she was diagnosed with arthritis in both knees, the doctor prescribed painkillers and said that at her age, it was normal. But her daughter-in-law, a nutritionist, suggested, cut out bread, sugar, and processed foods for just 1 month. Let's see what happens. Teresa agreed. At first it was difficult, as if she were being deprived of familiar joys. However, after 3 weeks, she noticed changes. In the morning, she got up with less stiffness, could walk more without stopping, and her mood improved. Most importantly, she realized that this was not just a diet, but care for her body from within. What to start with? Here is a practical list of what can be included today. For breakfast, oatmeal with chia seeds and blueberries, turmeric tea. For lunch, baked fish with sweet potato and a green salad with olive oil. Snack, a handful of walnuts and a low-sugar fruit, such as a plum. For dinner, homemade vegetable soup with pieces of chicken. Throughout the day, water with lemon, unsweetened herbal teas and broths, avoiding soda and packaged juices. Keep it simple. It's not about striving for perfection, but about consistency. Each meal is an opportunity to heal or harm. When the body receives what it needs, changes become noticeable. Reasonable and moderate movement is also important. One of the first recommendations many hear upon a diagnosis of arthritis is rest and avoiding physical activity. Although this may seem like logical advice, in many cases it turns out to be one of the worst. Not moving means worsening arthritis. Yes, during acute inflammation or severe pain, rest is indeed necessary. But if we make rest a way of life, we will find ourselves in a vicious circle. Less movement means weaker muscles, less stability in the joints, more pain, and even less movement. Our body needs movement to be healthy, especially the joints. Do you know that cartilage has no blood vessels of its own? This means that they receive nourishment precisely through movement. When you move a joint, the synovial fluid inside the joints is activated, delivering oxygen and nutrients to the cartilage. Therefore, it is said that cartilage thrives on good movement, but not every movement is suitable. It's not about heavy weights or marathons. It's important to do reasonable, gentle, and consistent exercises that take into account age and body condition. Here are 3 types of activities particularly recommended for arthritis. The first is swimming or water exercises. Water significantly reduces stress on the joints, allowing for pain-free movement and a sense of freedom. It also promotes better circulation, strengthens muscles, and induces relaxation. Just one 30-minute session in the water can work wonders. The second is gentle stretching. Stretching muscles, especially after long sitting or in the morning, increases flexibility and reduces stiffness. You don't need to be a professional, just master the basic movements. Arm circles, torso bends to the sides, gentle leg stretches while sitting on a chair. Thirdly, calm walks. Walking at a pace that suits your body, even if it's just 10 minutes a day, activates circulation, saturates cells with oxygen, and strengthens stabilizing muscles. It's not about speed, but consistency. Now, to help you get started, I suggest an example of a simple 10-minute routine for mild or moderate arthritis. Perform it every morning or after a daytime rest. From the first to the second minute, while sitting on a sturdy chair, alternately stretch your legs forward, keeping your knees straight. Slowly, 5 times for each leg. From the third to the fourth, gently rotate the feet in circular movements, first one way, then the other. After that, alternately lift and lower the heels. From the 5th to the 6th, standing and leaning on a table or chair back, lift the knees as if marching in place. Do 10 repetitions for each leg. From the 7th to the 8th, lean your body to the sides, hands on your hips. There's no need to lean too much. A light feeling of stretching is enough. From the 9th to the 10th, take a deep breath. Roll your shoulders in circular motions forward and backward. Finish with slow steps, feeling how the entire foot touches the floor. Such a routine activates the muscles and restores a sense of control and independence. Remember, you don't need much. It's important to do something every day. And if a joint hurts, do not abandon it. Move it gently and with respect, because movement is life. Cartilages are nourished by movement, but the right kind. Mind, pain, brain, and emotions. When it comes to arthritis, we often think only of bones, cartilage, and inflammation, but rarely mention the equally important aspect, our mind. This is not an abstraction, but a scientifically grounded fact. Chronic pain, for example, from osteoarthritis, significantly alters the functioning of the nervous system. Simply put, your brain doesn't just feel pain, it interprets it. If you live with this pain daily, the brain starts to adapt to the constant signals. Over time, he becomes more sensitive and reactive, as if in a state of anxiety, even if the physical damage has not worsened. It resembles how the sound of pain lingers at a high level, although the actual problem is no longer as significant. This phenomenon is called central sensitization, and many elderly people suffer from it without realizing it. Pain is felt not only in the joints, the entire nervous system is on high alert. The situation worsens during moments of stress, anxiety, or accumulated experiences. Have you ever noticed that on days when you feel more anxious, lonely, or tired, the pain seems to intensify? This is not a coincidence, but a direct connection between the body and mind. Chronic stress increases cortisol levels and maintains inflammation. Anxiety causes muscle tension and reduces mobility. Depression diminishes the desire to care for oneself, move, and seek solutions, creating a heavy fog that affects not only mood, but also intensifies physical pain. It is important to understand a truth that is rarely spoken. It is not only about physics. Your mind can either help or hinder. Therefore, modern osteoarthritis therapy programs increasingly incorporate emotional and mental aspects. This is part of a complex healing process, and sometimes simple daily habits can significantly change the situation. Here are 3 simple practices you can start applying today. The first is mindful breathing. It's as simple as sitting down, closing your eyes, and breathing deeply. Breathe in through your nose for a count of 4. Hold your breath for 2, and exhale through your mouth for a count of 6. Repeat this for 5 minutes, 1 to 2 times a day. This activates the parasympathetic nervous system, calms the body, and reduces muscle tension and inflammation. The second is meditation with audio accompaniment. You don't have to be an expert. You can find free recordings where a soft voice guides you through visualization. At first, it may be difficult to concentrate, but over time your mind will learn to enter a state of calm. 5 to 10 minutes of meditation a day can significantly reduce perceived pain intensity. The third is positive visualization. Close your eyes and imagine your body healing. Visualize your joints surrounded by light and how the pain gradually dissipates like smoke in the wind. It may seem simple, but the brain reacts to images almost as it does to reality, and this can activate internal restorative processes. And the most remarkable thing is that it requires no money or special equipment. One must simply allow oneself to care for one's mind, to calm down, and believe that the body can change. To understand that you are not reduced only to your pain, you are much more. It's not about denying what you feel, but about learning to live with it without letting pain control you. When the mind and body begin to work in harmony, new paths open up, easier and closer to you. We live in an era where there are remedies for almost all ailments. In the case of arthritis, supplements promise real miracles, such as relieving knee pain in just 30 days. Instant effect with little effort. But, as usual, the truth lies somewhere in between. Some supplements really help, others are useless, and some may even be harmful. Let's figure out which ones deserve attention, how to use them properly, and what to avoid. Let's start with those that have scientific backing and are often recommended by physiotherapists and nutritionists. The first is glucosamine, one of the most researched supplements for osteoarthritis. Glucosamine supports health and helps restore cartilage tissue. Although it does not act instantly, over time it can reduce pain and improve joint function. It is recommended to take it for at least 3 consecutive months to achieve noticeable effects, and it must be in pure form. Glucosamine sulfate. The second is chondroitin. It is often combined with glucosamine, creating an effective tandem. Chondroitin helps maintain the elasticity of cartilage and slows its degradation. A number of studies show that its effectiveness can be compared to some analgesics, but without undesirable side effects. The third is turmeric. This golden root spice is considered one of the most powerful natural anti-inflammatory agents. Its active component, curcumin, gently yet effectively reduces pain and inflammation. For better absorption, it is recommended to combine with black pepper or use in liposomal form. Taking it with food will also be more effective. The fourth is type 2 collagen, which is found in joint cartilage. Unlike type I collagen, which is present in skin and tendons, type 2 directly affects the joints. It is recommended to take it on an empty stomach once a day, preferably with vitamin C to enhance absorption. After about 90 days of regular intake, many notice reduced stiffness and increased mobility. The fifth is magnesium. This mineral is involved in more than 300 functions of the body. It relaxes muscles, reduces cramps, and improves sleep quality. In chronic pain, when muscle tension is high, magnesium becomes a true ally. It is best taken in the evening in forms like glycinate or citrate, which are easier to absorb. However, not all supplements have a beneficial effect, and not all are safe. There are products with empty promises, miracle formulas with many ingredients in one capsule, without evidence and research, without real results. Be cautious of promises to restore joints in 7 days or claims of complete healing without exercise and diet. Avoid additives with artificial colors, sugar, and unclear substances. Your body does not need extra chemical compounds. It requires real, delicate, and regular support. And, importantly, always consult a specialist before starting treatment, especially if you are already taking medications or have underlying conditions. Nowadays, many physiotherapists and nutritionists use integrative approaches that go beyond simple pill taking. It is about comprehensive support, including gentle physical exercises, anti-inflammatory nutrition, and emotional work. As we have already discussed, the body heals not partially, but as a whole. Therefore, if you choose supplements, do so consciously, viewing them not as a magic pill, but as an ally in your recovery journey. Allow yourself time and be consistent, strengthening your habits. Changes do not happen instantly. They come when you decide you deserve to improve your condition. Natural methods, supported by scientific research, become relevant when traditional medicines no longer yield the desired results, and surgeries seem undesirable. Many wonder if there are still opportunities with osteoarthritis. The answer is yes. There are several natural methods that have proven effective in reducing pain, decreasing inflammation, and improving joint mobility. This is not magic, and results may vary, but combined with good habits, they can truly change the situation. The first method is acupuncture. This ancient Chinese practice involves inserting thin needles into specific points on the body. There is no magic here, as it may seem at first glance. This method activates the nervous system, promotes the release of endorphins, natural pain relievers, and improves blood circulation in inflamed areas. Numerous studies have confirmed that acupuncture effectively reduces pain, especially in the knees and hips. It is important to consult qualified specialists, preferably in integrative medicine centers. The second method is zone therapy. Although it is less known, the results can sometimes be impressive. The essence of the method lies in introducing a mixture with ozone into problem areas, both injectively and through insufflation. Ozone has anti-inflammatory properties, improves tissue oxygenation, and stimulates cell regeneration. Improvements can be noticeable after 3 or 4 sessions. Let me tell you the story of Jorge. He is 74 years old and has suffered from arthritis in both knees for over 5 years. He has tried many remedies, painkillers, physiotherapy, supplements, but his mobility continued to decline. A friend advised him to try zone therapy. At first he hesitated because he didn't know anyone who had tried it, but eventually he decided to go for it. After the 3rd session, he noticed he was descending the stairs with less pain. By the 5th session, he was walking in the park again without a cane. Today he says that it is not a magical healing, but a spark igniting the recovery process. The third method is therapy with a cold, low-intensity laser. This laser does not heat or damage the skin. It stimulates energy production in cells, reduces inflammation, and accelerates the recovery of damaged tissues. It is successfully used in physiotherapy centers for tendinitis, bursitis, and of course, osteoarthritis. The procedure is painless, safe, and has no side effects. The fourth method is hydrotherapy. The therapeutic use of water, including warm pools, contrast baths, and directed showers, is one of the oldest and most effective ways to reduce joint pain. Water relieves pressure on the joints, allows for freer movement, and improves circulation. Additionally, it benefits both the body and the mind. How can you determine if alternative therapy is right for you? There are several key points. First and foremost, always consult a doctor before starting new methods. Even natural remedies can have interactions and contraindications. Choose only certified specialists. A sign reading ozonotherapy or acupuncture is not enough. It is important for a specialist to have relevant training and recognition in the professional community. Be cautious of excessive promises. If someone claims they can completely heal in a short time, it is better to walk away. Effective therapy does not promise miracles. It offers support. Pay close attention to your condition. Keeping a detailed journal will help. Note whether your condition has improved, if you sleep better, if you move more easily. Sometimes changes may be barely noticeable, but they are constant. And remember, such methods do not replace a healthy lifestyle, but complement it. This is support. They cannot replace physical activity, balanced nutrition, full rest, and emotional work. The good news is that many find new hope in these approaches. This can be a starting point for change. A small relief that combines with other changes can significantly alter life. Sometimes what seemed impossible only requires a new perspective on the problem. As for joint regeneration, is it possible? For many years, we have heard that cartilage does not regenerate. For millions of people, the diagnosis of osteoarthritis sounded like a sentence, but science does not stand still. Today, it is not only about alleviating pain. More and more, carefully but with hope, we speak of restoring what was lost. Yes, you heard right, about regeneration. Thanks to new medical technologies, we have learned that under certain conditions, the body can reform joint tissue. Not like at 20, of course, but enough to restore mobility, reduce pain, and improve quality of life. What methods exist? The first is plasma enriched with platelets, or PRP. The essence of the method is to take a small amount of blood, process it to concentrate the platelets, carriers of growth factors, and then inject it into the damaged joint. The goal is to stimulate natural tissue regeneration. Platelets act as messengers, informing the body that repairs are needed. A series of studies have shown that PRP reduces pain and improves joint function in mild and moderate osteoarthritis. Importantly, it's not an alien medicine, but your own body helping itself. The second method is stem cell therapy, a more complex and expensive approach. Stem cells have the ability to transform into different types of cells. In our case, they help restore cartilage, reduce inflammation, and improve joint structure. They are usually obtained from fatty tissue, such as the abdominal area or bone marrow, and returned to the damaged joint. Although research continues, the results are promising, especially in people aged 60 to 70 with mild arthritis. This is not magic, but a way to stop deterioration and sometimes reverse some processes. The third method is prolotherapy, a lesser known but interesting option. A soft, irritating solution, usually dextrose, is injected into the ligaments or tendons around the joint. Why is this necessary? To activate the healing response and create a small alarm signal, it is important to strengthen the tissues that stabilize the joints, which helps reduce instability and, consequently, lessen pain. Prolotherapy itself does not restore tissues, but it helps establish structural balance, which is critically important for protecting the remaining joint tissues. You may wonder if this works in practice. Yes, but with certain caveats. There are documented cases where after 2 or 3 PRP procedures, people began to move without pain again. Some, who postponed the surgery for prosthesis installation, were able to improve their condition thanks to stem cells. There were those who, with the help of prolotherapy, transitioned from needing a cane to freely climbing stairs. However, it should be noted that the results can vary. Age, extent of damage, overall health, and lifestyle all influence this. Moreover, these methods are not yet available to everyone. In some countries, they remain private or are considered experimental. Nevertheless, DOESN's message is that we are no longer limited to merely slowing down processes. We are beginning to restore. This is a new perspective on treating arthritis, an approach that not only extinguishes the fire, but aims to reforest. Although a definitive cure has yet to be found, there are real opportunities to improve quality of life. More mobility, less pain, more life. Do not give up when facing arthritis. Your joint future is not set in stone. There are common mistakes that can slow down the recovery process, invisible habits that hinder your healing, and you may not even be aware of them. The first is poor sleep. Sleep is the time for recovery. During sleep, the body regulates inflammatory processes, restores tissues, and balances hormones. Without quality sleep, the body cannot heal. Poor sleep only intensifies pain, reduces stress resilience, and worsens mood. Everything else, supplements, physical exercises, nutrition, loses its effectiveness. Secondly, the lack of water. Many elderly people do not drink enough fluids. Without enough water, joints do not receive the necessary lubrication. Cartilages, ligaments, and intervertebral discs need hydration. It is recommended to drink 6 to 8 glasses a day, one immediately after waking up, and the rest with each meal and before bed. It is a mistake to think that pain is normal with age. This is a dangerous misconception. Many believe that chronic pain, stiffness, and inflammation are part of aging and stop seeking solutions. To accept pain means to understand it and strive for improvement. To agree with it means to surrender. Age does not define your ability to heal. The fourth is the unwillingness to ask for help. Suffering in silence due to pride or fear is not a sign of strength. Asking for help is a responsibility to oneself. There are specialists and methods, and an honest conversation can be the first step. The fifth is the constant switching between various methods without achieving stability. By moving from one means to another without giving time to act, you won't allow your body to adapt. It's better to do a little, but regularly. Patience, consistency, and trust are key elements. A complete step-by-step strategy. Nutrition should be natural. Consume more green vegetables, fatty fish, turmeric, and red berries. Reduce intake of sugar, white bread, fried and ultra-processed foods. Move daily, dedicating at least 10 minutes to walking. Soft stretches or yoga are suitable for elderly people. Keep moving even if you don't feel like it. Take supplements like type 2 collagen and turmeric with magnesium for at least 3 months. Dedicate 5 minutes a day to mindful breathing. Be grateful for what you already have, and envision your healthy body. Remember the importance of rest. An hour before sleep, turn off screens and create a calm evening ritual with herbal tea, reading, or prayer. Here is the plan for the week. Day 1, exclude sugar from breakfast and drink a glass of water immediately after waking up. Take a 10-minute walk. Day 2, replace white bread with fruit and try a natural supplement. Spend 5 minutes on deep breathing. Day 3, do gentle stretching in the morning after waking up. Dinner and magnesium earlier. Day 4, avoid negative news, watch something funny, and call someone. Day 5, add turmeric to your dishes and place a pillow under your sore leg at night. Be thankful for something good. Day 6, review old photographs, remember your strength, and do a good deed. Day 7, assess your improvements. If something has gotten better, continue in that spirit. Don't try to change your whole life in 1 week. Make changes consciously, with love and faith. Your body seeks healing. It only needs your permission. The final message: pain can be part of the journey, but not the ultimate goal. The body is capable of recovering and strengthening even when it seems too late. Arthrosis is irreversible but requires effort and commitment to your body, rest, mind, nutrition, and relationships. Don't strive for perfection, just start. We all deserve a worthy life, free from pain and filled with hope. Thank you for listening to yourself and believing in yourself.